Hi, my name is Nicole Verrett, and I'm here to talk about the benefits of adventure therapy, specifically the use of high and low ropes elements. Adventure therapy encourages participants to engage in physically and mentally challenging new activities, and it's a really good tool to encourage you to step outside of your comfort zone and build a sense of community with the other folks that you're working with. Typically, adventure therapy is not done independently or alone. It's in a group setting, which is why it's such a good tool for learning about communication. This type of recreation therapy modality can really help somebody to step outside of themselves, change their perceptions and challenge their perceptions, and offers opportunities to change behaviors, oftentimes without even really knowing that that's what they're initially doing. Adventure therapy can be broken up into three main subsets. Adventure programming, which is programs that are designed to promote interpersonal and intrapersonal changes within the individual. Adventure activities, which are usually things more like camping, games, and problem-solving activities. And adventure therapies, which uses the adventure activities to work on specific treatment goals. There's four basic elements that I like to think about for adventure experiences, which are really important to the process. There's trust, communication, cooperation, and fun. Trust is number one because it's really important for a group to trust each other. Folks are not going to engage unless they feel like they're physically and emotionally safe. It's just as simple as that. Communication is really closely linked with trust, and it helps to keep problems from arising, and it helps us to learn from others. It's important for the facilitator to really set the tone for communication within a group about what's effective, what's safe, what's respectable. And it's an important thing to teach that what you communicate is just as important as the way that you communicate it. Cooperation is the third element, and this is because for adventure therapy, it takes a team to often accomplish the tasks that arise in adventure therapy, whether you're doing ropes course, whether you're camping out overnight, whether you're trying to cross a river. It's usually things that we can't do by ourselves, or for safety's sake we really shouldn't. The other thing is that it really helps people to learn to work together, and it helps to teach them what it is that they can contribute to a group, which helps them gain a sense of value and a place and a sense of mastery, which is really important. And the last element is fun. Even though adventure therapy is often serious business, there's a lot of safety elements to consider. It's important to as a facilitator, also instill that sense of fun, because that's what makes adventure therapy, I think, so appealing to so many people and to so many different populations. It's something that's rewarding to engage in. High and low element ropes course can be counted as adventure activities or adventure therapies. Just depends on how the program's used, the way that the staff is trained, how they process the information from the activity itself, and if it's focused on treatment-related goals. There have been research studies performed by Dr. Autry on the use of adventure therapy with adolescent girls. Hermanus Blomoff also studied adolescent boys, as well as Russell, Hans, and Hendy worked on meta-analyses over the effectiveness of adventure therapy programs and activities. And many of the studies looked at the longer lasting effects of these types of programs, and if behavioral and emotional changes that were made as a result of the adventure therapy could be sustained for more than a year after the programs ended. And oftentimes the results found were that the results, the changes were still there, but not quite as effective as they were initially. So, which is kind of to be expected. It's important to maintain, to work to maintain the changes that you have. That happens with just about any therapy that you look at. For my example, I'm looking at using the ropes course with individuals who have mental health disabilities, such as depression, anxiety, oppositional defiance disorder, or intermittent explosive disorder, and these are just to name a few. Looking at adolescents who are living in a residential treatment facility. And for planning it, I would think it's really important to first and foremost think about the safety of the clients and the staff who are attending the activity. The clients should be chosen carefully for the group. I'm thinking in terms of, this is a closed group from week to week or day to day, not a one-time activity, although it certainly could be a one-time event, more as like a team building or a group exercise. But in that case, it would be an adventure activity and not adventure therapy. It's important to think about the dynamics of the group, to think about what the different personalities are, what the diagnoses are that you're looking at, how they could potentially interact with each other. If these are residents who are living with each other, what are the dynamics on the unit? That's also really important to consider. The other thing is that it's important to take a look at where the physical location is of the ropes course, because if it's somewhere that's isolated in the woods, you're going to want to consider who are you taking, who's going to be with you in terms of facilitators. If there's a safety issue that arises either from the clients or, what if somebody falls and gets hurt? How are you going to accommodate that? The other really important thing is to think about clients who are actively suicidal or self-injurious are not, really appropriate for this type of an activity. It certainly is something that they can build up to, I think, but because safety is the main concern, you can't have underlying safety issues that need to be addressed first taking place down at a ropes course element. It's also important to think about what is the ratio of staff to clients. When I've done ropes course in the past, I found that using one staff to about 3 or 4 clients has been most appropriate, but I also like to, like I said, when I'm thinking about the clients who are going to be in the group, kind of stack the deck a little bit and select at least one client who you have a good relationship with as a facilitator, somebody that you trust, somebody that you know that the other residents look up to as a role model, not because it's somebody that you like as an adult, but more because it's somebody that the kids see, they're making progress in their treatment, maybe they're close to their discharge, I want to be like them. Another thing that I like to use to reiterate the safety and the commitment to the group with clients is the use of a 5-finger contract. So the hand is a nice representation for your 5-finger contract. It's an easy way to visually review what are the expectations for the group. I do this every time we go down there, sometimes twice during the group, to really hit home that this is one of the most important things to not only know but to actually follow. So the first is the pinky finger, and we start with the pinky because even though it's the smallest, it's the most important. If you have a fist made, if you need to unclench somebody's fist, the pinky is actually the weakest point. So the pinky represents safety. Safety towards ourselves, safety towards other people, our physical and emotional safety, and the elements and things in the environment that we're using. Next is the ring finger. So we use this to symbolize commitment to the group, to the activity. We're not going to walk away before it's finished. We're not going to leave a man behind, so to speak. The next is our middle finger, which often is a sign of disrespect, but in this instance we're saying that it is the sign of respect. We're going to respect each other. We're going to respect the opinions of other people, the environment around us. The index finger is representing including, so we're including everybody in the group. We're making sure that we're working as a team and not isolating people. And the thumb is the last one for have fun. The other important thing that I like to reiterate when doing a ropes course with individuals is that it's a challenge by choice. We're asking you to, as a participant, step outside of your comfort zone, but it's important for you to really challenge yourself and say, okay, here's where I'm comfortable. I'm willing to take one baby step to the next level. And then it's your job as the facilitator to say, okay, I'm going to help you to try to reach that next level because you said it's okay. When working in ropes course high and low elements, it's really important as a facilitator to have the proper training and certifications so that you understand all of the safety concerns that go into, especially if you're going to be belaying, but also in low elements. It's really important because you're going to be teaching most of those safety things to the people that you're working with, the clients. How do you spot somebody? How do you support them in an appropriate way? If I need to hold your hand, do I interlock my fingers, or do I grab your wrists? Another really important thing for the facilitators is think about the sequencing of the events. How are you organizing what elements that you're using? Are you starting off on the ground, maybe trust falls, and then building up to other low elements, such as trolleys or a whale watch or a swinging log, and then building your way up to high elements. Could be a catwalk, a multivine, or a rock wall. The example that I'd like to give for this activity is what's called a whale watch, which is a giant seesaw. It's basically a big plank rocking platform which rests on one pivot point, a log. The goal of this low element is to balance the platform for an extended period of time. And it can be quite a challenge, even though it seems like something that's simple. You're not high off the ground, but there are safety elements that are really important. If you have a group of 5 to 10 people on here, if you have people who get frustrated and step off, think of a teeter-totter when you're little. Somebody gets off the other end, boom, you go down, right? It's important to have the participants learn to communicate effectively with each other while they're still on there, so that they're not putting other people or themselves at risks. When you're working with folks who have mental health issues, it's also really important to be able to recognize signs and symptoms of distress so that communication can really be encouraged, and that the clients are encouraged to express their thoughts and feelings in a safe way without, like I said, putting other people at risk. The other thing that I really like to do with a ropes course group is to have them set their own goals. Besides the challenge by choice, by saying, yeah, I want to take it up a notch here and try to walk on the catwalk instead of just climbing up the ladder. You are encouraging them to set goals based on what their treatment goals are. This is how you kind of can tie it back to their treatment plan. And as individuals, you want to challenge each other. You say these goals out loud, you say them in a group. You're going to use it to process at the end of the group. To say, well, how did you work on managing, your frustrations? How did you let it out safely, or things like that? Ropes course can be a really great tool to address a lot of different issues, and it's a neat process to be able to participate in and to watch with clients as they kind of have those aha moments. So I hope you've enjoyed learning a little bit about ropes course, and if you hadn't had a chance to experience it, I hope you'll get out there and do that.